Ang naalala ko lang po nun, sumakay lang po ako dun sa may itaas nung tabang giginto. Papunta po ng Malolos crossing para po sumakay ng jeep pahagonoy. Ang huling ang sumunod na natandaan ko na po nun nasa ambulansya po ako nun. Dadalhin po ako dito. Gabi po ako inilabas sa kabanatuhan nun.
Naglulupasay na ako sa amin nung na-confirm ko talaga dahil tinawagan ko yung cellphone niya, sabi niya, nakausap ko Ito po ba yung nanay ng pasyente may-ari ng cellphone? O ba ito ano nangyari? Andito kasabit yung anak ninyo at semi-comatose. Siyempre, semi-comatose, alam mo naman, na-aksidente nga daw. Mag-hysterical ko talaga, anak mo. Yun, tapos pinunta na namin talagang alas siyang tingnan siya ng ganyan. Dito, tapos nilagyan siya ng tornilyo dito.
Nilagyan po tornilyo dito sa may spine po na nagkoconnect sa buhok. Tapos dito po, titanium plate po kasi deformed daw po yung right side ng ulo ko dito.
I'm Dr. 𝙎𝙖𝙖𝙖𝙗𝙬. I am the neurosurgeon who handled the case of patient Mendoza. So he was admitted as a case of traumatic brain injury, secondary to motor vehicular accident. He definitely needed brain surgery. However, because of a spinal cord injury, we cannot operate on him right away without a reduction of the said cervical spine surgery. So before we did the brain surgery, we need spine surgery first, which was done by our ortho here in Sacred Heart Hospital. And so after it was done, after it was reduced and fixated with the screw, we were then able to do the brain surgery. So it was an eventful procedure. Patient also was referred to 𝙈𝙬𝙗𝙬 because of traumatic avulsion of his eye. So it was a multidisciplinary approach wherein from an ortho, a neurosurgeon, and also an 𝙈𝙬𝙗 handled his case.
Yung sa mata po, dahil nakaluwa po siya, ginupitan lang po siya dito ng konti para po maipasok. Tapos malaki pa din po yung pamamaga niya. Pero nung nagpapahid na naman po ng gamot po na antibiotic sa mata, yun, unti-unti po, napapansin na po namin yung pagliit tsaka nag-warm compress po.
I'm Dr. Jim Tripol, and I'm the ophthalmologist that was referred this case. So when the patient came in, aside from the large calvarium fracture, he also had a large orbital roof fracture causing a retrobulbar hematoma. What a retrobulbar hematoma is, there's blood behind the eyeball pushing it out. No? And this blood inside the orbit would compress on the optic nerve, compromising the blood supply. So I had to do a lateral canthotomy to make space for the globe to be able to move and to relieve the pressure on the optic nerve in the hopes of saving the optic nerve from the pressure of the retrobulbar hemorrhage. During the surgery of the calvarium, wala namang surgical intervention yung ophtha at the time. So after the surgery, we just needed to wait for the swelling to subside and hopefully bumalik yung vision. Unfortunately, masyadong na-compromise yung blood supply ng optic nerve over the course of the injury, and baka rin may traumatic optic nerve injury. So, hindi na-restore yung vision ng patient.
Hindi na daw makakakita dahil nagkaroon daw ng mata, ng damage yung tawag na
Yung optic nerve daw po matagal na daw po naipit dahil sa pamamaga. Yung buto ko po dito, bali po siya kaya nilagyan din po siya dito ng titanium tabakan.
I am Dr. Maureen Velasco, a spine orthopedic surgeon in Sacred Heart Hospital. This is regarding our patient. who was referred to me due to cervical spine fracture as well as a clavicular fracture. So he was referred to me. I already saw him in the ward. He was already properly immobilized with the cervical collar, and ancillary procedures were already done. What Jordan had was C2 fracture, a type 2, which should be immobilized and which should be fixed. Initially, since he was a multiply injured patient, I planned for a close reduction and application of a halo brace. However, since he had multiple fractures in the face and in the calvarium, I opted for a close reduction and application of screw. So, on the day of the surgery, so we supervise his transfers. So, the cervical spine is immobilized properly during the whole process. The cervical spine is not aggressively moved during the procedure of induction. So we were fortunate that our anesthesiologist was very competent in handling the case. At the OR, we did a close reduction of the odontoid and screw fixation. And we were able to do this procedure because we had appropriate facilities at the OR. After which, we proceeded then with the open reduction and plate fixation of the clavicle. Now, at follow-up, the patient is already ambulatory and without neurologic deficits.
Papasalamat ako na sabi ko, masasabi ko na husay. Na talagang nadugtungan ba, siyempre, kung makikita mo talaga, nakapikit, naihina sa salawan, tapos dinala nga na sa ibang ospital, maga pa rin ang mata, magang-magay mata, luwa. Hindi nila namin dito luwa ang mata. Magang-maga yung muka. Kasi, nilagyan nga ng ganito dahil nga daw may sa mapa. Yun. Tapos nung dinala ko dito, nabuhay. Talagang pag makikita mo, wala siya sa sarili. Pero umana nakadikwatro yan nagsiselfon sa hangin. Tapos kung ano ni sinasabi tungkol doon sa trabaho niya.
Subok at maaasahan po. Kasi dati pa din po, dito na din po nagpapa-check up si Papa, tas ilang beses na din po siyang na-admit dito.
Naniniwala pa naman sa himala at higit po. Higit sa lahat sa kanya.
Sacred Heart, subok at maaasahan.
Sacred Heart Hospital of Malolos, serbisyong subok at kalingang maaasahan.